Hi, good afternoon or good morning for those of you who are not joining from the East Coast. Thank you for joining Microsoft and Quisitive. Quisitive being one of Microsoft's most trusted healthcare focused partners for today's webinar. Today, we'll be discussing the proposed updates to the HIPAA security rule and how to prepare for it. So one thing of note, I do want to call out that this webinar is going to be recorded. If you wish not to be recorded, please disconnect now, but we'll be sure to follow up with you the entire presentation as well as the recording. I'm Jill Westman. I work at Microsoft. I'm a Partner Solution Sales Manager. I'll be your moderator, and then we'll be followed by some of our guest speakers today. So we have Ed Higgins from Quisitive. He's the Director of Security and Compliance. And we have Ricardo and Tyler Alexander, Ricardo Castillo. They are technical specialists at Microsoft. So together we are going to talk about the HIPAA security rule, the potential updates, and how to prepare for that. Prepare for it from a product perspective, as well as from a services, expectation, checklist requirements perspective. So as we get started, again, the main focus here is looking at HIPAA. Why are we here today? And how did we get started? So this is just a brief timeline. So back in 2003, HIPAA requirements, especially for security, were put into place. The security really focused on three main areas: administrative, technical, and physical protocols. The important thing to look at here is what I have in bold, which is the covered entities. So when we think about what is a covered entity, right? It is a healthcare provider, companies offering health plans, or healthcare clearing houses. That was the main focus about it. And it was really looking at protected health information. And at the time, it served its purpose. As we advanced throughout the years, the HITECH Act was put into place. What is so significant about that is the HITECH Act, amongst other things, really brought in the responsibility of those security protocols to the business associates. So a business associate is any other company that provides services to or on behalf of the covered entity. So again, realizing that the ecosystem of different companies were expanding throughout the years. And as, digital footprints took a greater shape, HIPAA had to make sure they were accommodating for that and that the rules and requirements were really bringing in more companies. Also, what was significant there was the introduction of EHR, right? So it's the electronic health records, because technology was advancing and there were more opportunities for technology to come into play. That's when, the HITECH Act really had to start addressing potential data breaches, how those had to be notified. So in the beginning, it was a recommendation to let companies know about a data breach. Then it became, here's a time frame in which you have to do that. Something interesting that also came about at that time is what they call, it's a nickname, the HIPAA Wall of Shame. That was the first time, because of the HITECH Act, that companies who did experience a data breach, they had to not only notify Health and Human Services, they also were published on a website. So it became more apparent that companies had to really be strict about their security protocols. And now that's where we are today. So at the end of December, there are additional and new proposed updates that are being discussed. Those now become more to prevent any type of phishing or ransomware attacks, right? So you'll see that digital footprint as it's growing. These proposed updates are really put in place for stronger security controls. So it's really end-to-end encryption for data that's in transit and in storage. It's multi-factor authentication, It's the third party or those business associates, right? Not only now does the business associate have to notify different agencies and entities of potential data breaches, there's a contract now called the Business Associate Agreement, which Microsoft does put into place to accommodate. So, really, what it's saying is these covered entities used to be the only parties that were really responsible. Now it's expanded out into these business associates, which is really helpful because it's anyone that's touching this data. And incident response, the breach reporting. So here's what's really different, even from the introduction of the HITECH Act. What's happening is there are tighter timeframes in which breaches need to be made known to these government agencies, which now requires continuous monitoring protocols, disaster recovery plans. So no longer is it acceptable to say there was a data breach. We need to notify these different entities and agencies within 60 days or 90 days. It has to be immediate, which then requires those protocols to be in place to constantly monitor to ensure that there is no risks coming into place. So with all of this, you'll see the advancements that are coming throughout the years, and it really reflects the need for tighter and stronger cybersecurity controls in healthcare. One quick thing, the timeline below, because these are rules that are under consideration right now, this timeline shows that they might be put into place come midsummer. So there's no better time than now for us to come together to discuss these different modifications and what that means for you and your business.
So let me take it from here for a moment. What Jill shared with us was on the HITECH Act, the Wall of Shame back in 2008, 2009, when a breach happened of more than 500 persons' patient health information, you had to report that. We did a study. We looked at that Wall of Shame. It's a website. It's dedicated to those types of disclosures, unauthorized disclosures of patient health information, and we analyzed that. And what you can see here is the very clear and distinct ramp up. It's almost like a hockey stick, where back in 2008 and 2009, the hacking incidents were relatively small. Those are the kind of dark blue. You can kind of see a dark purple or blue, depending on your screen resolution. What has happened is that has grown significantly to where in 2024, the hacking incidents were greater than they ever have been. So that's one note. And then the amount of unauthorized disclosures of patient health information were nearly as great as the last largest record, which was in 2021. We had that huge, significant global breach that was in the billions of records. And this is second only to that. So last year was not a good year, and the trend is growing. So there's a lot one could take out of this. But if you look at that pie chart, the majority of these are hacking and intrusions. That it actually speaks to exactly why the authors of HIPAA and the administrators in the government have introduced those technical requirements, because cybersecurity is one of the major reasons why these breaches are occurring. And let's say we haven't done a good job in the HIPAA and HITECH Act and space of defining what those things are to address them. So the HIPAA law, the senators and Congress that make up HIPAA enforcement and put this law into the community to review, said we're done. We need to implement technologies that align with this and be more prescriptive, sharpen the timeline. So this is what this session here is all about. And it shows you that this was the cause, and the effect was the new laws that are coming our way. And if you think about it, regardless of whether that law kicks in and becomes effective in summer or December or say it never did, what we're going to talk about today are still good practices around IT security that we all should just look at as pragmatic, good guidance and best practice for protecting our patients and patient health records.
So we want to start off with a little bit of interactivity, right? We don't need you to raise your hand or shout anything out, but this was something that was really insightful when we came across this, right? So you can obviously read this slide, but outside of HHS's Office for Civil Rights, are there any other agencies that can put penalties in place towards HIPAA violations? The answer is false. So really, when we think about it, they are not the only agency. And if we look on the next slide, it's really important. And this is why these regulations are coming into place. And there's much more tighter restrictions because there are 4 additional agencies that can really factor into any type of a policy violation. And the chart at the bottom, right? So if we look at the OCR penalty, what does OCR mean, right? It's the Office for Civil Rights. So that's a penalty there. That's a part of HHS. The SAG penalty, SAG is any state attorney general. So this chart just gives some baseline of what could happen if some of these stricter guidelines and regulations are not adhered to. So there are multiple agencies and entities that really come into play. And an astonishing thing too, a breach has so many cost implications, with the average cost being somewhere around $10 million. So there really is a lot at stake.
And there is a lot at stake. And if you think about one occurrence, a large breach in your environment, the reputational damage is a whole nother level. But then the fines, the care and protections that are afforded the patient when their data is breached, there's a follow-on. That cost is significant, and it's difficult to gain back. It's very difficult to earn back trust when it's lost. So, $10 million. The cost of these things to implement is not even close to that. So, when you look at how do I comply with this law as cheaply as possible? Well, one breach is it only takes one of those. And the cost of implementing good safety measures within your estate, within your IT environment and the systems that you operate is relatively low by comparison. This is a nutshell for you. This is not the entirety of HIPAA. There's a lot of things in HIPAA. This is just the new things. So over on the left, these are things that are kind of built in. AI is now part of the framework. You want to have AI responsible use policy. You want to establish an AI steering committee. There are things that AI, the use cases of it, those things, if you're not well founded on the use of AI in your environment, they could lead to disclosures of sensitive data like PHI. So we want to make sure you see that that's also in that law. And things that were called out as addressable in the past. Hey, here's a rule, you need to address that. They're no longer addressable, they're kind of mandatory. So there's a little bit of vocabulary change being introduced in this law that talks about, things are mandated. You don't really have a choice, you have to do these things. The other parts that may not be technology laden, but written policies, written procedures, documenting the workflows of how things interact within your IT and data handling estates, the compliance periods, the timelines that have been adjusted. Jill made mention to that, but the reporting of an intrusion needs to be a lot faster to both the affected and then regulators. And then, updates and language changes, like the terminology used in the past, back in 2003 and 2008, is a lot different than it is today. So the legislation puts into place better language that is more akin to today's modern language in terms and conditions. In the middle, these are new kind of technological requirements. So asset inventory, patch management, configuration management, running compliance audits against that technology. These are things that you can do, or you can hire someone to do. Doesn't always require an auditor on the outside to look at your compliance. The word auditor in this case, or the word compliance audit, is to look at your own compliance and your own risk management frameworks periodically, in this case, every year, and review them and create a report that says, are we getting better? How do we have lessons learned? Things like that. Then vulnerability management. When a vulnerability, becomes aware to the industry, usually patches come out. So having a vulnerability management program to stay alert when a vulnerability comes out, and then having the resources to go patch it so that it doesn't stay vulnerable for an unreasonable period of time, and then backup and recovery, not just protecting data from an accidental deletion. That's important. But what if the environment was ransomware and encrypted? You have to be able to fall back and recover from that. So they're talking about things like that. And then again, some of the notable new things, having risk analysis, workforce security, the things around employee training are one thing, but evaluating your business partners, and that's not necessarily those alliances with healthcare shared data. That's your vendors to your IT. So, like if Quisitive was a vendor to your healthcare or hospital, you should be evaluating, are we secure in how we carry out the work we do for you? This is where that's getting a little bit more legs underneath it. And then having contingencies. And then those things that Jill mentioned, the multi-factor authentication, the technological requirements. We're going to get into that. We're going to, share the floor a little bit and speak to those. But this is a nutshell, if ever there was one, the kind of the Cliff Notes edition for what do I need to see? This would be a pretty good roadmap, we think, to be able to see this and kind of lay out what's the difference between where we were last year and where we are moving into this year. So what we've done is we kind of draw some kind of arrows to point into these to kind of give some tips. These don't have to be the exact answer, but they're a good one. We've leveraged these technologies at Quisitive through thousands and thousands of engagements. That's what we do for a living, is implement these things, both administrative controls, the written policy things, but also deploying the technologies. Here we're showcasing our finesse on leveraging Microsoft's stack, their technologies like Intune, Compliance Manager, MFA, Entra ID, Purview, the data protection side of Purview, the governance side of Purview, to be able to identify sensitive data and then tag it as sensitive data and do a lot of that stuff automatically for you. And so we're going to get into this a little bit more, but things like the vulnerability management, things you could do on your endpoints and your servers to put bad stuff away, to prevent it from harming your devices. We'll talk about these and touch upon these things and give you some insight into things to look at and follow-ups that could be had. Now, this is an area that is maybe again the non-technical things. So we wanted to put a few words to the right-hand side where those arrows kind of point over to the right. So on the left, you see what is the requirement, the nutshell version. There might be 4 or 5 paragraphs that defines what is written documentation, but we boiled it down to say, having updates to your written policies, your IT security policies that employees read, that vendors are obligated to comply with, stuff like that. Those things have to be done annually. So, sometimes people might need a little bit of help. Yeah, of course, we can help you with that, but we're calling out the things that you might need to look at to be able to do in your environment. And so the timelines affect these things as well. So looking at your policies and updating them on an annual basis, doing your vulnerability scans. The law is putting out 6 months. In the payment card industry, it's monthly. So there's a little bit of a timeline difference. They're being kind of generous a little bit, if I will, as a security practitioner of 30 years. Vulnerability scans each 6 months is a start, and I'd expect it to become a little bit more stringent over time if I was to be a fortune teller in the HIPAA space, and then carrying out things like a pen test annually. But these are things that are executing a certain thing. It could be a risk analysis. It's something that your team could do, building a risk register to say, here's our systems. Here's the ones that hold electronic patient records. Here's the ones that don't. Here's how we isolate them, our network diagrams, having that documentation. It's required here. Network diagrams are part of the plan. So you have to have that. But then being able to rank each of those assets that you have in your asset inventory. You have to have an inventory of all these technology assets where data could live. And then you have to assign a risk ranking to that to say, well, it's a web server. We can recreate it in 5 minutes. So it isn't important if that went down. We can recover from it. So it's a ranking of 5. Or this has electronic patient health records. We need to A, secure it, and B, it needs to be up all the time. It might have a higher ranking from that risk profile. So it deserves more care and feeding. Though that's what we talk about. That's what they talk about. The bureaucrats who created this law put it in place to define a structure. And it's actually a very good structure. Those of you who may be familiar with, say, GDPR and some of these other privacy protections, this is carrying over a little bit of similarities to that. So it doesn't map it one-to-one, but there are a bit of similarities with it. So let me hand this over to Ricardo to chat on some of the flow and how things move and what we deal with as security practitioners.
Yeah. So the next points here we'll focus on a bit of what we've seen, right, with some of our customers and a bit of what we see in the industry. A lot of the times we'll have protection in these different realms, right? We'll protect our email, we'll protect the identity, we'll protect the endpoint, and we'll try to protect as much as possible, but typically it turns into silos, right? They're different technologies, different portals that your admins have to go to in order to protect these realms. So what tends to happen, and if we can go to the next slide, please, is that at times when an attacker comes in, it takes cybersecurity teams a bit longer to realize where this either started or maybe understand, when could we have caught it or when could we have prevented this realm. So this is where Microsoft is a bit different, right? And offers a benefit, if we don't mind going to the next slide. So most of the time when we speak with customers, they're obviously trying to protect their most valuable assets as much as possible. So when you think of Microsoft, instead of maybe relying on a single wall to keep intruders out, we like to encourage our customers to think of constructing multiple layers of defense, with each designed to address different types of threats. This way, even if one layer is breached, as we saw in the previous slides, the other still stands strong, providing that comprehensive protection. So with Microsoft's AI-first end-to-end security platform, this offers those multiple layers of defense across various environments, whether you're multi-cloud, multi-platform, and even now, right, multi-AI. So by integrating solutions like Microsoft Purview, Microsoft Priva, Microsoft Entra, Microsoft Intune, Microsoft Defender, right, and even Microsoft Sentinel, organizations can ensure that their digital assets are safeguarded from the various angles, allowing your security teams to feel like they have everything in place, right? And also addressing that concern sometimes of not putting all your eggs in one basket by providing a robust, multi-faceted defense strategy. So why Microsoft? Microsoft offers, as we mentioned, comprehensive protection across different multi-clouds, multi-platforms. And we mentioned the different technologies and solutions that come into play. On top of that, Microsoft's unique AI-first approach integrates things like Copilot into most of these security experiences, allowing your teams to not only feel more effective, but also more efficient. And when we think of these new HIPAA changes and addressing them, these changes include a more detailed and ongoing risk assessment process, stronger emphasis on third-party vendor management, and a more robust incident detection and response, right, when it comes to some of these items. So typically what's being encouraged now is, right, modernizing. So this is where Microsoft solutions can help healthcare organizations comply, right, with these new requirements by providing tools for encryption, multi-factor authentication, vulnerability assessments, and network segmentation. And if we now move to the next slides, we're going to show you a few examples of what that could potentially look like, right, for your organization. So if we start with number one, right, if you think of identity, right, multi-factor authentication, right, enforcement. This is when you start to think of technologies like Microsoft Entra ID, right, Passkey, the Authenticator app. And then when we start moving to that next layer of encryption, right, of data, this is when you start to now think of Microsoft Purview. And the same goes, right, vulnerability and risk analysis for assets related to EPHI, right? Not only is it a Purview thing, but now we also introduce things like Microsoft Defender. And if we can go to the next slide. And then we've moved to that next layer, right? When you start to think of your, not just your endpoints, but maybe where some of this data lives, right? Those servers, right? We continue that protection by leveraging things like Microsoft Defender. And then if we start to consider how do we respond, right? A lot of the times organizations, as mentioned earlier, that response time can take a bit, right? So Microsoft offers different technologies in this realm, as you can see here in point number 5, to help you feel that you can address this concern. And then require network segmentation, right? Some of these technologies you may already be implementing in one way or another, right? But here's an example of how Microsoft solutions can help. So with that, I'll hand it over now.
Perfect. So another pop quiz number 2, right? How many security signals does Microsoft process in a given day? So think to yourselves what you think that answer might be. And that answer actually is 78 trillion, which is absolutely astronomical. So if we go to the next slide, it's really important. So seeing some of the questions in the chat, healthcare is an attractive target for financially motivated cyber criminals. It's due to the fact that there's a broad attack surface, right? We've got legacy systems and inconsistent security protocols. So while we've got CISO regulations, we have HIPAA regulations, it's so imperative to start looking at these, taking your checklist, going through and making sure you're identifying any of those potential vulnerabilities, because ransomware, especially for healthcare, is so prevalent. And when you think about, putting in, you need to put in a defense in-depth type of strategy. We need to secure every layer of the infrastructure. As Ricardo had mentioned, that means from the network to the different endpoints, all the way to the cloud. Because as we saw earlier, we saw some of those siloed areas. And when there's many different point solutions across those siloed areas, there's gaps. And that's where those vulnerabilities lie. And so having that layered security posture, it reduces the risk of overall ransomware attacks. So again, taking into account healthcare. So any of that personal data in healthcare is rich, and it's always going to be one of those largest targets, unfortunately, for a lot of the bad actors out there. So one thing we wanted to point out, these charts are a little bit small, but really what we just want to call your attention to is Microsoft has been recognized in the industry by multiple sources as being in the upper right quadrants, which means that we have vast experience and expertise and some of the best products out there to help ensure these vulnerabilities are met and that security requirements are bar none.
So I was muted. I'm sorry about that. Just a little bit about us. We've been in the healthcare business our entire existence here at Quisitive, not just the last few years, but going back to the inception of our business. We've worked with hospitals, physician networks, healthcare insureds, insurance providers, manufacturers of healthcare equipment, and on and on. And the thing that resonates is that we've been a Microsoft partner that whole time. We believe in the stack. That picture that Jill just showed you about being in the magic quadrant, in Gartner's magic quadrant, not just in one, but on most of them. The security technologies, that is a direct result of, the commitment Microsoft made to even the US White House several years back, that we will invest $4 billion a year on security R&D alone to prevent cyber attacks from occurring. No technology is perfect, but what Microsoft has really done is created a compelling argument to take a look at these technologies and embrace them. You might actually own most of them already and leverage them to safeguard your estate. Our team at Quisitive has done this for many hundreds. We're a partner of the year in many places. We're also what's considered a Microsoft Intelligence Security Association partner, a MISA partner, which gives us insight and access to a lot of different programs. So we can carry out advanced security assessments. We can do compliance consulting. We can help you write those policies and those written procedures. But we've done 20,000 plus Microsoft implementations of the M365 and Azure security features. So when your team needs that expertise to come in and put hands on the keyboard and help you to get it done, we can come in and help you. We could do it as a project. We could do it as a continuous improvement. We can provide a little augmentation to your staff, to your teams, and we can provide that consultative view to bring those best practices that Microsoft has made those huge investments to create those blueprints. Well, we take them and leverage them, but we also have that experience of the know-how of implementing them. So we see ourselves as a good candidate to being your partner on this journey, and we certainly know the things that are coming forward with HIPAA, not just from the old days or the HITECH Act days, but the current ones. I've seen a couple of notes from colleagues saying, how does this align with HITRUST certification? Well, HITRUST is a good standard. It's a closed standard. You have to pay to get into it, but we work with that. When you have that, we can help you instrument the environment. One thing that we wanted to share here was that because of our healthcare, because of this new law, and because many of our healthcare partners, clients out there, and just, hospitals out in the, heartland of America may not have the resources to go tackle all these new things coming. So we created a service. We call it HIPAA 2025 Quick Start, and it basically is a packaging of all of our best ofs, and we've bundled them to be able to take action and implement these for your environment. What it brings is that expert coaching, that expert advice on, out of all these security things, here's the best way to solve it. There might be 5 different ways to solve every security challenge you've got, but by working with our team to know those other things that are important, we'll guide on the best way out of 5 to implement all of those pieces and parts and align them up so that the timing, the user experience doesn't suffer. We're in the business of monitoring and acting on those alerts that come to us, so we can be that monitoring environment for you. We automate a lot of the things that are manual and mundane and routine to help promote efficiencies, to make your team more efficient so that your IT and security folks can focus on the most important stuff, where we've automated the less important stuff or the things that are really important that are just routine. We can automate those, and we're big believers on that, and leveraging, of course, the AI side of things to help us with that. We always put a human set of eyes on every AI generated thing, but we leverage those things to give us insights, such as like if an identity logs in from 2 places at the same time, well, we can see that and generate an alert and take action on it and put in an automation to screen that and help you out. This is a simple example, but we get into all those types of surfaces, and it kind of is akin to where Ricardo showed you those pictures of how an attacker might move laterally. Well, we counter all of those attack vectors, all those points, by putting in a good program, a good healthy architecture, and helping you get that done and comply with this new law. So a couple of things we wanted to make sure, and there's a gimme, there's a prize, and we wanted to say that if those of you who are joining here are interested and have a consult with us about this program, sit down with us, talk to us about what it could do for you, how much does it cost, the timeline we put in forward, and we're bringing that guidance and gap analysis. We're aligned with the regulations. You know, like I said earlier on, and like we chatted in the chat already, you know, a lot of these things are good practices, regardless of whether this law hooks or not, or takes place or not, becomes effective, becomes enforced, however we want to say it. Regardless of that, the things that are being cited in it are good best practices. You ought to look at them anyway. But if you know, I get it, you have to prioritize risks and spend. We completely understand that. But if your team wants to sit down with us and go through that and what that consult looks like before the middle of March, we'll give away up to, you know, the first 10 that come and take us up on our offer. We'll put out a $50 DoorDash card but from our team to yours, just to say thank you for that opportunity to show you what we can bring to the table. The QR code to kind of enroll in that is to the right. So if you want to take your camera or wait till the slide deck comes out, either way, that's quite fine. But, you know, if you want to jump in and take a look at what this program can do and how we've aligned it to help most healthcare and life sciences clients meet this requirement, go ahead and click on it, and we'll get you a DoorDash card as a thank you.
Perfect. And for anyone on this call who might be attending HIMSS next week, Microsoft will be there, Quisitive will be there, and please join us at our reception. So I also put that information in the chat as well for a clickable link. The timing is perfect here. I'm sure you're going to hear a lot about these different regulations next week as well. So as Ed mentioned, please don't hesitate to reach out to Quisitive, to your sales representative here at Microsoft. We're more than happy to help and answer any additional questions you have.
Exactly. Now, this one is if you're contemplating a look at AI and agentic AI in the future, take us up on this. We're putting together a webinar the 27th of March. It's going to be really, really exciting. We've got a great AI team. They're going to be leading that, and it aligns with, you know, healthcare and IT leaders, what you need to know. So take advantage of this. It doesn't cost you anything to join it, and it's going to be a really exciting event. I wanted to share that. And I wanted to mention, if you have any questions, you know, reach out to us, ask@quisitive.com. Any of us on this panel are open books. You can reach out to us through, but the convenient way is just ask@quisitive.com, and we'll make sure that we get the questions you have or the interest that you have to the right people, in the right time, right away. And if you're interested in the agentic AI session, you know, taking a look at that session, register with it. The QR code is there again, and you can kind of join us for that event. It should be pretty exciting. I think lastly, and then we're going to kind of take questions. Let's kind of maybe jump into the questions. We'd like to know what your feedback is on this session. So do take a moment. We measure our improvements. We always want to get better. We always want to do a greater job to bring value to you here as our customers and maybe future customers. We do these things to provide insight, but we always want to make improvements. So take a look at that QR and give us give us your feedback. We'd love to have it so it can help us. And without that, without hesitating a little longer, let's kind of look at some of the questions. Can we maybe open up the dialogue and make sure that we can see if there are any questions for us to answer? I know that we had a question from Britain, a kind of dialogue there. I think we might have answered them. There's an added question. Any other tools beyond M365 E5 licensing, beyond Intune and Defender? Intune is one that you want to consider because Intune device management gives you that other leg of the stool. So if you have good identity is, you got to have that. So E5 gives you that. E5 gives you an awful lot of power in that. And and when you couple identity risk, the analytics that comes out of impossible travel, improbable travel, and so forth, or potentially compromised user account because of the heuristics, or someone's password combo was shared in the dark web. All that stuff is monitored and gives us intelligence. Those could be put into conditional access rules to say, all right, Ed is not a risky user because he hasn't had those events, but he's not on a device that is managed by the enterprise. So let's make sure to hit him with a ping of MFA. That's where conditional access rules and risk-based conditional access rules can greatly enhance your user experience. So Intune is great, and it's one of those things that you'll want to consider. In similar to like GDPR, where individual privacy is a concern. That's the law in GDPR, and U.S. businesses are affected by it in the protection of EU residents' privacy. Similarly, with healthcare patient information, we need to safeguard it. And so, if you think about those requirements and you think about the correlations to things like GDPR, well, privacy matters too. And things like, Microsoft Priva, privacy management, opting in and opting out. Some of your environments already kind of do that. Do you want to opt in for some information from our third-party partners? Those are kind of legal requirements in some circles. And so Priva can actually help you with a lot of that. And of course, the insider behaviors and the analytics that come out of that. So there's a lot of products. Schedule some time with us to chat, to drill in further beyond like the Microsoft 365 E5. It's a solid place. It covers an awful lot, but things like Intune might be on the fringe of that. And then things like Sentinel to correlate all those events, that's an Azure thing. And it's actually, you own it already, but the way that it's managed is by consumption of logs, and kind of you pay for how you consume it. So there's a kind of a great story there. There's a lot of power in Sentinel, and we can help automate some of the things that Sentinel picks up on, because consider it a correlation engine. All these alerts come into one place, and Sentinel can put that pane of glass on your analysts' desktops, and then coupling with like Copilot for Security or Security Copilot, and some of the automations from the SOAR, Security Orchestration and Automated Remediation part of Sentinel, SOAR. We can automate a lot of the remediation. If it looks like a duck and it smells like a duck, then remediate the bad duck. Well, a lot of things can be done in Sentinel, and it's not an E5 SKU at all. But great question, and appreciate it. Thank you. Do we have any other questions? Jill, do you see any that we haven't answered? I want to make sure.
I think we're good.
There's Britton asked another question. Good questions too, mind you. Kind of correlating Defender for Identity and vulnerability, and to identify the vulnerability. We do that. We leverage Defender for Endpoint, Defender for Server, and kind of bring those portals together. We actually have a managed service to do vulnerability management and remediation. That might not be what you're asking about, but we leverage the defenders and that layer of vulnerability management where, there's nothing wrong with Tenable or Qualys. The CEO of Tenable, God rest his soul, was a very good friend of mine from a long time ago. But they're a good shop. Those are good scanning tools. Microsoft has done a really good job with the access to those CVVs and vulnerabilities, and they own the operating system in the largest market share for operating systems that exist. Arguably, you see that with Windows servers and platforms out there. So they're able to see vulnerabilities when they happen. So they've got a pretty substantial knowledge base that is part of the same fabric that a Qualys or a Tenable would use. So Defender holds its own right up there with the ability to scan and trigger patching in your vulnerability management program. So if there's multiple parts of the question. Maybe there's a follow-on that we ought to take offline, but we definitely can get into that. And that, the kind of the I see where you're going. It's probably a little bit longer conversation, Britton, but great dialogue. I hope that the little bit that I shared here with that correlation, but we leverage that all the time in our programs for clients. That's how we are efficient with vulnerability management, is by leveraging Defender. Any other teams? Team, do you have any? Our team that's helping with the call. Do you all have any additional questions that you're fielding elsewhere? Or
So Ed, maybe we can have you address, what would next steps be for someone to do to look at these new laws?
yeah, great. It's a great opportunity to visit on that. So, where could someone get started? You might already have MFA implemented in your estate. Why would we come and re-implement things that are already there? So sometimes one of the greatest places to start, and with that program we described, the HIPAA 2025 Quick Start, we actually embed in what we call an assessment at the front end of that. And what we do is we come in and look at your Microsoft estate, your environment, what's lit up, what tools are enabled, what tools may be dormant yet. Maybe you don't know about those capabilities. You might own them, but they may not be turned on. So we do an assessment and we look at all of them, and we go into the rabbit holes of identity, data, device, app, and access, and it creates a roadmap and a pragmatic, a realistic list of things to do now, first 3 months. Quick wins your team can act on to, one, meet the requirements, and two, not upset the user community. Some of these things may greatly improve your posture and not even involve the end user. Why wouldn't you do those things? So we think in terms of that when we lay out our assessments, as well as if something risky is happening, like right now, you'd want to take action on that more sooner than later. So when we do those assessments, we lay out a good, healthy roadmap of like 1 to 3, 3 to 6, 6 months and beyond for your team to act on. You can bring us in and help you fix things, but the design of that thing is to give you the list of, like a punch list that we'd act on. Now, when we pivot that into the service offering, if we've already implemented MFA, we look at the efficacy of that. We go into the rabbit hole of using MFA and SMS textings to people's phones is not a secure way of doing MFA. I can compromise most cell phones by what's called a SIM swap attack. I'm not trying to scare people, but the advancements in technology need to be kept up with. So we think in terms of leveraging that authenticator app on your phone. And that makes it even more complicated, and it's a solid source of MFA. Or using your Windows Hello to have, in some cases you might be prohibited, but some cases you might be allowed to use a fingerprint or a biometric read from your PC to authenticate the user, or a PIN, stuff like that. Those are advancements that keep MFA in place and make it better without the risk of the SMS text becoming an ineffective solution. And of course, we think about passwordless. Why even use a password if there's alternatives that are much more secure? So get rid of the whole password entirely, and we have ways to tackle that. So our assessment looks at where you are in your journey and helps kind of pivot that. And that's a good place to start. And then, having that first conversation with us, we'll tell you about what the program is, and we'll talk to you as a consultancy about how to leverage what you already own. We'll ask a bunch of questions, but then we'll come up with some ideas. So, good place to start is have a conversation with us. Next best place to start is have us come into your house and do an assessment with your team, do it for you. And then it's really easy on your team's time. We do all the work. So we come in, we do that work, we review the findings and the opportunities and lay that out for you. But great. Thank you for giving me that prompt, Jill. Thank you.
Sure thing. So in closing, thank you so much for joining us today. We hope this was really beneficial and we were able to shed a lot of light on these proposed modifications. One thing we know for sure is that patient data, it is so rich and it always is going to be a valuable target for, cyber criminals, and to get ahead of that, right? Regardless of the different rules that actually get published or put into play, to be prepared and to be enabled and empowered about this various information and the capabilities and what exists out there. At Microsoft, we hope we can help answer any questions. So like we said, please don't hesitate to reach out to Quisitive, to your Microsoft salesperson, reach back out to this chat group. We'll also follow up with all of this great information. And we so appreciate your time today. Hopefully we'll see you at HIMSS next week and or have some future meetings together. So thank you again.
Thank you all for your time.